In medical school, we're taught to always offer a procedure or a medication.
It's very natural for a physician to pursue and want to pursue aggressive treatment. That's the way we were trained.
We may have given you the best chemotherapy, or we may have given you, all the procedures you needed to have to fix that heart valve, that your body still felt the need to, it still progressed along this pathway.
Physicians are human beings, and we feel things just like the rest of the world.
That it's not about us as practitioners and what our goals are for the patient. It's about what the patient's goals are for themselves.
Just think about the environment in an institutional setting of a hospital. Think about the lack of intimacy that's in a nondescript room with a monitor, with machines going off, and with hospital staff running in and out.
I think a lot of people think that hospice means giving up, and it's really a shifting of the goals of care. So it's a change from curing to caring. We're not going to abandon the patient. We're not going to not see you anymore or care for you. We're just shifting our goals from focusing on a cure and focusing on procedures to focusing on quality of life and focusing on continuing to care for you for whatever time there may be left.
In initiating hospice care, it seems to be more challenging and more difficult the later stage of a terminal illness.
It doesn't just start at the time when you think about moving someone on to hospice care, that any time you have a diagnosis of a terminal illness, whether it's COPD or dementia or cancer, that you begin those discussions about what if and what the pathway looks like. What that does is it allows you to run that thread of conversation through every visit that you have with the patient.
Physicians who have enrolled patients in hospice sooner have not only preserved the quality of life at the same length of life, but also to aid in the quality that the patient and the family will receive during that very, very, very critical time.
I think it's important for other physicians to realize that placing their patient on hospice or having that hospice discussion is not taking away from any of the care or treatment that they have provided.